Telangana state. His vision is to build Hyderabad as the largest center for startups and entrepreneurship activities in India called T-Hub.
Why don't I do that? Good morning to all of you. Firstly, I'd like to congratulate IIT Hyderabad on kicking off the Center for Healthcare Entrepreneurship, because as you know, and as was mentioned by both Professor Desai and also by Mr. Mohan Reddy, Government of Telangana, along with IIT Hyderabad, NALSAR, and also ISB, the Indian School of Business, has launched on the 5th of November what is the country's largest technology incubator. Now I'm glad, in succession with the thinking of the government, in lines with the thinking of our Honorable Prime Minister as well, who for the first time in the country, in the history of this country, standing on Red Foot on the 15th of August said, "Start up India, stand up India." So I think it is in line with our Honorable Prime Minister's thinking, it is in line with our Honorable Chief Minister's thinking. The intent of what we started off with T-Hub, I'm glad it is being continued, I'm glad it is being picked up by an eminent institution such as IIT Hyderabad as well. Well, coming to healthcare and the very purpose of this CHE, which is being set up at IIT Hyderabad, I would say this: healthcare is an area, I think, which definitely needs a lot of disruption, which definitely needs the support from a lot of innovators. Because whatever Avinash might say, I would say this. Avinash had mentioned that India has a problem, India has a lot of need for healthcare. In fact, I would say even the most developed countries in the world, I've lived in the US for about 8 years, even the most developed countries in the world haven't gotten around to solving the Medicare or healthcare problem. There is still a discussion on Obamacare, there is still a discussion, everything else that has got to do with providing affordable health even in the United States. So this is a universal problem. This is not just a problem confined to India. This is not just a problem confined to any one particular country in the world. I think universal, affordable healthcare is a challenge, and the more innovations, the more breakthroughs, the more disruptions that can come through, I think we should all welcome them wholeheartedly and openly. The role of the government in such situations, I think, in most cases, especially when it comes to innovations and disruptions in a country like India, is twofold. While the private sector may innovate, while the private sector may improvise, while the private sector can come up with all kinds of disruptions, I think the government can do two things. One, the government can be an early adopter of the technologies that come through and give them an opportunity to showcase at a larger scale and scale it up if need be. And the government can incentivize, most importantly. The government can actually come forward and reward these innovators to ensure that whatever cost they've borne, they can be at least partly subsidized, partly incentivized. I think that's probably where, both the government and the private sector needs to work and, forge a very strong relationship. So I would welcome IIT Hyderabad to actually work with the government as well, Government of Telangana that is, because we are, in fact, mulling, as we prepare our next budget, an innovation fund for our T-Hub. We're also looking at promoting more and more entrepreneurship in different sectors. And this blends in nicely with the theme that we are pushing, because for the city of Hyderabad, which is our capital city, and which currently has a population of more than 1 crore people, which is almost 30% plus of the state, what we have in mind is very simple. We have 3 specific sector sectors which we consider our thrust areas: information technology, aerospace and defense, and healthcare and life sciences. So information technology, we all know Hyderabad has already established its presence, has already been doing very well in terms of IT-enabled services. Now we are trying to ride the next wave of growth by promoting T-Hub, by promoting startup ecosystem across different other subsectors within information technology as well. Even as we speak, in fact, I think about in 3 days from now, on the 5th of December, under the aegis of T-Hub, we're also going to launch another specific incubation center for gaming and animation sector. Again, I'm happy that you're doing a healthcare hub here. We're doing a gaming and animation hub, and there is also the thinking to also kickstart aerospace and defense related incubation center as well. So to put it in one sentence, it's raining, I think, incubation centers in Hyderabad. While it's raining, pouring cats and dogs elsewhere, I think it's raining incubation centers here. But the point I'm trying to make is, coming to healthcare, I think healthcare is one sector. I'm not sure who said it, but it was said, the key to have a good idea is to have as many ideas as possible. So the more the incubators, the more the innovators, the more the people who want to come and innovate, the more the people who want to come and try it out, I think the better it is. Because once you have all these young minds working together, once you have mentorship happening, once you have market research showing you the direction, once you have VCs from the Bay Area coming in and telling you that we are with you, I think that's the right kind of ecosystem for us to get going. So having said this, and having given you an idea on what we're thinking with respect to healthcare, we would also like to, I would also like to point out to a couple other things that we're trying out also. For example, leveraging technology in healthcare and how government can actually do its own bit in terms of thinking differently, not exactly disruptively, but thinking differently. One big challenge in public healthcare system today that I've noticed in the last 6 years of being a legislator, 6 years of being a lawmaker, is that there is not enough accountability in public healthcare system. The government doctors, the medical practitioners, typically they've lost confidence of the people. They've lost confidence of the people because the government institutions have lost confidence, not just the medical practitioners. Because people do not find someone when they actually walk into a public healthcare system. So what can we do using technology? In fact, myself and our health minister, we are part of a health subcommittee. What we have started thinking is, why can't we actually install webcams and use something like a Skype in every PHC? And we can randomly, every so often, the health secretary, the health commissioner, the health minister can go online, and out of the 1,000 PHCs that we have across the state, we can just quickly take a roll call if need be, in the middle of the day. Just take a quick roll call. Keep them on their toes. Instill confidence among people that public healthcare systems will be and shall be, attentive to their needs. The second thing we also have started working on, and which I'm extremely excited about, there is an imperative need for any state in the country today, and we want to be the first state in the country to do that, to digitize health records of each and every citizen of the state. And we have started out in the right earnest. In fact, we are doing a pilot right now, sir, and we will probably be the first state in the country to have a comprehensive database, a digital health records of each and every citizen in the state. That would be about 3.6 crores, which is about 36 million people of this state. Once you have such a database ready, then and if you have an integrated database, whichever PHC you walk in, a public institute or a private healthcare institute, all you have to present is probably your Aadhaar or one of your unique IDs that you have, which will all be linked and which will all be synced. So there won't be much wastage of time in trying to find out what your blood group is and what medical preconditions that you may have, or what other allergies you may have, etc., etc. So that gives you that valuable lead time, I think, which is extremely important, especially in trauma care kind of conditions. The other thing we are also planning is, what we've realized is, in the last 16 to 18 months, while the secondary and the tertiary care facilities are quite good in our country, secondary and tertiary are mostly in the hands of, again, dominated, I would say, by private sector. Even the government is doing all right in the secondary and tertiary sector, because most of these are located in the urban areas. So there is not a big problem of the physicians or the surgeons, etc., not showing up, or the specialists not showing up. But the bigger challenge is in the primary healthcare system of this country. So even there, we are trying our own bit. In fact, about a couple of days back, we had a discussion with a private sector player who wanted to come in and revamp our urban and rural healthcare centers. So we are trying out a pilot there as well. We are also trying to see if we can actually give incremental benefit to people, the citizens of this country, without actually taxing them, without actually making them pay more. So in total, what I would like to say is this: technology which does not bring about a social change, especially in a sector as important as healthcare, I think is futile. We can create the fanciest of tools. We can create the fanciest of technological disruptions, but if it actually does not create a flutter, if it does not actually bring about a social change, I don't think it is worth it. So having said this, I would like to thank IIT Hyderabad for giving us this wonderful opportunity, and I hope and pray that Center for Healthcare Entrepreneurship in IIT Hyderabad succeeds and brings about a lot of disruptions which are much needed for the universe at large. Thank you so much, and I really appreciate this opportunity.